Hello, my name is Dr. Leana Wen. I'm the Baltimore City Health Commissioner, and this session is part of Hospital Management Asia's video log series. I'm here to speak as an emergency physician and also as Baltimore City's doctor to give you 3 ideas for how we can improve and transform healthcare. First is to really focus on patient and family-centered care. I remember attending a conference a couple years ago that was on how to make hospitals and health systems more patient and family-centered. And the speaker asked everyone in the audience, how many of you here are not just here as physicians or clinical administrators, but how many of you are here wearing your hat as a patient or family member? And nobody raised their hands in a room of over 500 people. And it was a stark reminder of how so often we try to make change based on what we think patients and family members want, but we don't really inquire as to what it is that they need. And so first idea is to make sure that patients and family members are in the room where decisions are made, and we as clinicians and administrators will learn something completely different, and that will shape our views accordingly. Second is to recognize that health is not just about healthcare. In the ER, I was treating a child who kept on coming in, an 8-year-old who kept on coming in with symptoms of asthma. And every time medically, we would know how to help him. The problem was that we could just give him steroids or inhalers and help him in that moment. But there was the question of where he was going. He was going back to a house where everybody in his family smoked. They lived across the street from an incinerator. There were all these other conditions in the environment that were making him unhealthy. In fact, studies show that even though 97% of healthcare costs are spent in the hospital, less than 10% of what determines how long you live and the quality of your life depends on the care you get in a hospital, but actually depends on all these other factors of where we work, where we live, where we play. In Baltimore City, where I live, there are neighborhoods just a few miles apart where a child born today can expect to live 20 years more or less than another child. And it's that aspect of the environment, that aspect of health that we also must focus on. And therefore, we must make every interaction a point of intervention, recognizing, for the second point, that health is not just about healthcare. Third, look for opportunities to move the needle and lift up what is working. A couple of examples from Baltimore City. In 2009, we had one of the worst infant mortality rates in the country. Our babies were dying at the same rate as babies born in the middle of civil war in war-torn countries. And it was not acceptable that an African-American baby born in 2009 was 5 times more likely to die than a white baby. So we formed a collaborative called Be More for Healthy Babies, led by the health department, together with over 150 public and private partners across our city. And as a result of home visiting services, as a result of teaching the ABCs of safe sleep, as a result of doing aggressive community level outreach, we have reduced the infant mortality in our city by nearly 40%. And also close the disparity between Black and white infant mortality by over 50%. That's an example of how interventions through a collective impact strategy can move the needle, and is something that we should look to replicate. Overdose deaths have also been plaguing our city. As a result, we passed legislation so that as of about 2 years ago in 2015, I issued a standing order, a blanket prescription to every one of our residents in the city. We trained over 23,000 people, and everyday residents have saved the lives of over 800 of our fellow neighbors and friends and community members. There's a lot more for us to do to increase treatment for the disease of addiction, but 800 lives saved is something tangible. It's a tangible, important result that we must hold on to and keep on raising up and highlighting these examples. Now, the work that we do is hard, and it takes a lot of effort, but we must all commit to making a difference, because where our children live should not determine if they live. And we didn't go into our chosen professions in healthcare because it's easy. It is a profound privilege for us to be serving our community, serving our patients, and to be here with you today. Should you be interested to learn more about the current healthcare challenges and issues, you can attend the 16th Hospital Management Asia Conference this August in Manila. Thank you.